level to reduce background noise. Question to the panelists or in general may be posted in the chat box or on our YouTube channel, where also this event is being broadcast live. We will be taking the questions in a consolidated manner at the end of the program. I now have the pleasure of inviting Ambassador of India, His Excellency Shri Kumar Tuhin, to address and enrich the gathering with his thoughts and vision on the occasion. Ambassador Tuhin has been a driving force in strengthening India-Hungary bilateral relations and is an ardent follower of Ayurveda, yoga, and naturopathy. Thank you, sir. Ambassador, sir.
Yeah, okay. Good morning, everyone. Before again I proceed, Sanjeev, is it okay? My audio is okay now?
Sir, your audio is okay, but we can't see you. Probably your camera.
My camera now?
No, sir. अभी ठीक आ रहा था पीछे.
Okay.
Sir, if you can rejoin again, just refresh.
Refresh. Okay.
Refresh the tab. I think, sir, your camera is off now. You can open
camera is off. Okay, let me just refresh the tab again.
Okay. Yes, that will.
Can you see me now?
Not yet.
I think, sir, is there some layer over the camera? Yes, yeah.
Layer? No, it was.
No, we can see you now. Yes.
Now it's okay. You can hear me also.
Yes.
Okay. Okay, great. Good morning, everyone. At the outset, I extend my greetings and best wishes to all of you in advance on the occasion of Ayurveda Day and Dhanvantri Jayanti, which is who is the god or deity of medicine. Normally, this is held around November 12th or 13th. But since we are speaking today and we are speaking on the topic of Ayurveda, it will be apt that we also remember Dhanvantri today. I am indeed delighted to see such an illustrious panel of speakers at this webinar, and that goes to indicate the relevance of this topic and its importance. COVID-19 is still around, and it continues to take a huge toll on lives and livelihood around the world. Scientists and doctors are vigorously pursuing their research for most effective ways to fight the virus, including on research for a vaccine. Now, while this research continues, a few things which are becoming a bit clear already at this stage are: one, that while this particular epidemic is particularly severe compared to a few others that we had faced in the last few decades, but this will not be the last time that we are faced with a virus or such a virulent disease. And two, Vaccines will give us an important tool in our fight against the virus. But at the same time, the realization that humanity ought to stay in harmony with nature around us so as to achieve holistic, sustainable, and long lasting health is now important much more than before. Now, Sanjeev, who spoke before us, he in his brief initial remarks mentioned about Ayurveda being the knowledge of life. And Ayurveda has correctly mentioned this in the Sushruta Sutra when it says that sam dosha, samagnischa, sam dhatu, marakriya, prasannat mendriya mana swastha ittami dhyate, which broadly mentions that one is in a perfect health when the three doshas and digestive fire, the fire for digestion, assimilation, and metabolism, all the body tissues and components, all the excretory functions are in perfect order, and the person is with a pleasantly disposed and content mind, senses, and spirit. The benefits of Ayurveda are increasingly being recognized all over the world. The quest for good health and freedom from various illnesses is universal. But the world today not only wants to be healthy, but also wants to be holistically well, which can be fulfilled by Ayurveda. Today, everywhere, the feeling of back to basics and back to nature is also becoming stronger. In such a scenario, a favorable environment is being created for Ayurveda, and there is a need to increase the visibility and salience of this form of medicine. Ayurveda as a medical practice also has a wider scope and includes several subjects like social health and environmental health and public health, etc. But the disease will still be there. And so how do we fight this? I was talking to a few friends a few days ago in the Ministry of Health and Family Welfare. And we were talking about, again, Ayurveda and some of these ancient wisdom that we have in our books. And somebody told me that in Atharvaveda, we speak about Atharvani, Angirasi, Daivi, Manushyaja, Ut. So these 4 forms of medicine. Atharvani being treatment through meditation, yoga, studying scriptures, knowledge of life, mind control, etc. Angirasi being the use of 6 rasas, Madhur, Amla, Lavan, Katu, Tikta, Kasaya, etc. Daivi, of course, being the treatment through the 5 elements and the proper use, using the energy of sun, moon, Havan, inner science, etc. And the 4th one, Manushyaja, medicinal treatment using herbs, plants, surgery, bhasm, another form. So sometimes we notice that when we are looking for treatment for COVID-19, our search appears to be restricted to the last form, in the form of tablets and vaccines, etc. Now, this is not to deny their importance, but we should not lose sight of the other forms that are mentioned and prescribed. Of course, Ministry of Ayush, again, this was mentioned earlier, that they have on their website mentioned several protocols, and they have worked out in very details the treatment which should be imparted to people who are suffering from COVID-19 and people who are getting exposed to that. And even in the last form, which is the vaccines and tablets, etc., Ayurveda has shown some very promising results. Again, my friend in the ministry, he was mentioning to me that a few days ago, CCRS had conducted a case study, and which was done probably with All India Institute of Medical Sciences, where they found that the medicine Fifatrol, it was used very effectively in treatment of patients, and people, the patients who were affected with COVID, they turned COVID negative in only 6 or 7 days after using these medicines. Apart from the Fifatrol, I think the people were also given some medicine like Ayushquat, Sheshmani, Vati, Lakshmi Vilas Rasa, etc. Now, of course, just like this study in in April 2020, also combination of other medicines like Guduchi and Pipla, and also some other medicines were given to patients in Jaipur hospital and some other hospitals too in India. And all these have yielded very, very positive results. I'm told that Giloy was found to have worked in some cases much better than HCQ in people who were admitted. And also, these patients had no post-recovery complications. So these are all very, very promising. But I know there are eminent experts on our panel who will throw more light in a much better fashion than I can probably mention. So I'm quite happy to see there are also many Hungarian friends and eminent experts who are on our panel, and they will be able to bring the Hungarian perspective out, and which will make our webinar stand out from those many webinars that are being held on this topic all over the world. Now, in Hungary, we already have a very active cooperation going on with the government of Hungary and with universities here in the area of traditional medicines and Ayurveda. We had signed an agreement with the government on cooperation in traditional systems of medicines in 2013. And subsequently, we of course had a MOU on establishment of Ayurveda chair. And again, two of our former chairs, Professor Baghel and Professor Asmita Vele, are today with us. And I again extend my very warm greetings and felicitations to both of them for joining us. I'm very happy to see them. There is also, we have our Ayush cell. And during the COVID times, this was still functioning, and we were conducting some consultations. This was very, very effective. I hope that today's webinar will provide the requisite information and wisdom to understand and counter this COVID-19 challenge that is threatening to cripple our normal lives. So with these words, I wish you all a very productive discussion today, and hope that this webinar will throw more light on this topic. So with these, I extend my greetings to all of you. Thank you very much.
Thank you, sir, for your remarks and guidance. Thank you very much. Now I have the honor of inviting our special guest and keynote speaker, Professor Mahesh Vyas, Dean, All India Institute of Ayurveda, a premier institute under the Ministry of Ayush, New Delhi. Dr. Vyas has 22 years of postgraduate teaching experience in the Department of Samhita, Siddhanta, and to his credit has more than 145 research papers. He has also delivered more than 175 guest lectures in various national and international conferences. Professor Vyas would like to share with us the recent initiatives of the Ministry of Ayush in management of COVID-19. Professor Vyas.
Very good morning to all. Honorable His Excellency Mr. Kumar Tuhin, Ambassador of India to Hungary, Dr. Ivan, Associate Professor and Vice President of the Hungarian Scientific Society of Ayurveda, and all other members. On behalf of the Ministry of Ayush, Government of India, I extend my sincere appreciation for the event. We are wholeheartedly thankful to Embassy of India Hungary for conducting this webinar on significance of Ayurveda in COVID-19 times, which is the need of era when the whole world is under the grip of corona pandemic. My heartfelt congratulations to the Embassy of India Hungary. At the outset, I would like to take this opportunity to welcome my fellow speakers, Professor M.S. Baghel, Consultant Ministry of Ayush and former Ayurveda Chair Hungary and former Director IPGT and RA Gujarat Ayurveda University Jamnagar. Dr. Zoltan, Secretary General, Hungarian Rectors Conference. Dr. Jens Joseph, Ayurveda Practitioner, Brahma Ayurveda Hungary. Professor Asmita Vele, Head Department of Rasa Shastra and Bheshaj Kalpana, Bharati Vidyapit, Deemed University, College of Ayurveda Pune, and former Ayurveda Chair Hungary. Mr. Sanjeev Manchanda, commercial representative and chief coordinator, are key person of this webinar. Dr. Shahjahan Saju, Ayush Information Cell, Embassy of India, Hungary. Miss Andrea Bozo, Hungarian actress and brand ambassador yoga. Miss Bhagirathi Chaitanya, Vedic Foundation of the Himalayas. Miss Andrea from Center for Homeopathic Education, Budapest. Mr. Sudeep Kumar Jha, Ayush expert, Hungarian Ayurveda Medical Foundation, Budapest, and Miss Borbala Siddha therapist. I also welcome all the viewers who joined this webinar live on from different countries. It's my great pleasure to be a part of this international India-Hungary webinar on significance of Ayurveda in COVID-19, organized by Embassy of India, Budapest, Hungary, as a part of 5th Ayurveda Day celebration. Indeed, it's a very auspicious day for all Ayurveda supporters that on the eve of Ayurveda Day, we all are together for this webinar. Every year on Dhanvantri Trayodashi, that is 2 days before Deepavali, which is on 13th November this year, we are celebrating Dhanvantri Jayanti as Ayurveda Day. So I wish you all a very happy Ayurveda Day. May Lord Dhanvantari shower you all with good health and happiness. We are happy to share that our Honorable Prime Minister of India, Shri Narendra Modi ji, conferred that status of Institute of National Importance, INI, to the Institute of Teaching and Research in Ayurveda, Jamnagar, and on 5th Ayurveda Day, our beloved Prime Minister going to announce. It's a matter of proud for whole Ayurveda fraternity. The health promotion is one of the priority area focused by the Government of India, Ministry of Ayush, to provide the best healthcare system for the world. A separate ministry to promote health of people through Indian traditional system of medicine, that is Ayurveda, Yoga and Naturopathy, Siddha, Swarikpa, Unani, as well as Homeopathy. Ministry of Ayush, under its fellowship scheme, extends financial support to the eligible foreign nationals for undertaking undergraduate, postgraduate, and PhD courses in premium institute in India. 104 scholarships are offered every year to the eligible foreign nationals from 98 countries. Ministry also welcomes foreign students for Ayurveda and Yoga courses under Study in India program. The program is a unique initiative of the Government of India, will help the student fraternity from across the globe. When the pandemic of COVID-19 started, there was no available treatment, and at that hard time, Ayurveda has taken the lead role under Ministry of Ayush. Ministry of Ayush has released various treatment protocols against the COVID-19 pandemic, which are being followed not only in India, but also across the globe. The Ministry of Ayush issued treatment protocols which are being implemented in various CSC centers in India. The apex Ayurveda institutes like Alidia Institute of Ayurveda, New Delhi, National Institute of Ayurveda, Jaipur, and IPGT and RA Jamnagar, and other Ayurveda institutes have played great role in dealing with this pandemic. If we follow the diet and lifestyle explained in Ayurveda, which includes daily regime, seasonal regime, Sadavrata, that is code of conduct, rules of taking diet, etc., then suddenly we can improve our immune system and can stand strong against the spread of COVID-19. In Ayurveda, we have the concept of epidemics by the name Janpadodvansa and communicable disease by the name Upsargik Roga. Acharya Sushruta in ancient Ayurveda text, Sushruta Samhita has mentioned about communicable disease, and he said that one can avoid such disease by following social distancing, covering a face, and by maintaining hand hygiene. Surprisingly, these measures are only the weapons to prevent the spread of COVID 19. This clearly depicts what Ayurveda specified thousands of years back is still valid. Ayurveda is an ancient science of life that focus first on the preventive aspect, then curative aspect. This is the reason that Ayurveda has given its foremost principles as maintaining the health of the healthy. And thereafter, it aims to treat the disease. In the case of COVID-19 or any other infections, it is important to adopt preventive measures to avoid the infection, and Ayurveda very well explains it. All India Institute of Ayurveda, the Apex Institute under Ministry of Ayush, is doing various activities to fight against COVID-19. It includes implementation of Ayu Raksha project that involved more than 80,000 Delhi police personals and were given with Ayu Raksha kit that contains Chavanprash, Anutela, Farnasya, Ayushwatha, and Shanshamnivati immunity boosters. We are happy to say that the incidence of COVID 19 cases are significantly reduced after taking these medications. Establishment of CHC Center at All India Institute of Ayurveda that is successfully treating COVID positive patients with Ayurvedic drugs. Establishment of COVID-19 call center that guide the citizens about diet and lifestyle to be followed. Now, Ministry of Ayush has developed and implemented post-COVID management protocol which to be followed at different levels, which are at individual level, one should follow use of mask, hand hygiene, physical distancing, drink sufficient amount of warm water, mild exercise, and Ayush medicines like Guduchi, Ashwagandha, Chavanaprash, and golden milk, etc. As a stronger immune system is always required to fight against any infectious agents such as COVID-19. Ojas is also known as Bala because it provides strength to the body in terms of physical, mental, and immunological. It controls the whole working system of the body. Hence, Ayurveda advised to improve immune system. Appropriate inclusion of the principles of Ayurveda such as Dinacharya, Ritucharya, Sadavrata, Rasayana, Panchakarma, Yoga and meditation can help an individual to maintain the positive health by enhancing their immunity. Ayurveda has described the wholesome and unwholesome dietetics and lifestyle aspects like celibacy, bathing with lukewarm water, sleeping at appropriate time, and exercising. One must incorporate this aspect in daily life to obtain the benefit in the present situation COVID-19. Agni is the most important aspect, and acharyas have given due respect to it. It is believed that strength, health, and longevity of a person all are depend on the Agni. Hence, re-establishment of the Agni becomes an important part to take care of COVID-19 patients. Ministry of Ayush has also advised that spices such as turmeric, ginger, coriander, black pepper must be included in our food. As respiratory system is majorly affected with the coronavirus, therefore it is advised to gargle with turmeric water twice a day to keep respiratory tract free from infectious agents. Turmeric being antiviral, protective, and healing in nature helps in keeping away the throat infection and ultimately clearing the respiratory pathway. Ministry of Ayush has recommended Ayush Quats and said that this can boost the immune system. It is combination of four medicinal herbs commonly used in every kitchen: tulsi, Dalchini, Shunti, and Krishnamrich. Panchkarma removes the vitiated doshas out from the body. These are Vamana, Virechana, Niruha, Anuvasanvasti, and Nasya. Hence, to remove the toxins and the vitiated doshas, one must undergo this procedure regularly or timely as and when required. Acharyas consider that application of sesame oil, coconut oil, or ghee, anutel nasya in morning and evening. It lubricates the nasal passage, preventing allergies and sore throat. Yoga is the best way to maintain the physical health at par and includes the various body posture. Surya Namaskar, one of the best yogic exercise. The term Ayurveda is derived from the Sanskrit word Ayu, life, and Ved means knowledge. That is, Ayurveda means science of life. There are several treatment options are available for enhancing immunity. This includes certain rasayanas. Ayurvedic rejuvenation therapy must be taken into consideration. Rasayan means nutrition at all level. Rasayan that can be used to get the benefits are Chavanprash, Agastha Haritki Rasayan, Brahma Rasayan, Kantakari Avale, Ashwagandha, etc. At the end, on the behalf of Ministry of Ayush, I extend my heartfelt congratulations to Embassy of India, Hungary, for the grand success of this webinar. Thank you, one and all. Thank you very much.
Thank you, sir, for your enlightening views and participating in the webinar. Please accept our congratulations and thank you for participating. Ladies and gentlemen, our next speaker today is Dr. Ivan Shelkai, Associate Professor and Vice President of the Hungarian Scientific Society of Ayurveda. Dr. Shelkai and four
Yes,
other...
I am here. Namaste.
Please, Dr. Shelkai. Thank
Yes,
you.
I am here.
Yes, please carry on.
Namaste, everyone. Dear colleagues, I am Dr. Ivan Salkai, leader of Ayurveda education at the University of Miskolc. The topic days is today the COVID-19 disease. Earlier, we wrote on the paper from prevention of this disease. In my opinion, prevention is more useful than therapy because presently we have not a good therapy for COVID disease. We need prevention. However, I would like to speak to you about our Ayurveda training. Our goal is to integrate Ayurveda and Western medicine in COVID and in other problems. I would like to introduce two of my talented students, Dr. István Lukács, pain therapist, and Csongor Cserép, psychologist. Please listen to their presentation. István, please start. István Lukács.
Yes, I'm here. Can you hear me?
We can hear you, Mr. István. Please carry on.
Okay. Dear Ambassador, all the professors and the audience, I would like to welcome everybody. Namaste. I'm glad to represent my university, University of Miskolc. Thank you for the chance to share my thoughts with you about the difference between the pain management in Western medicine and Ayurveda based on my thesis. In this short time, I just try to highlight briefly why the Western world needs Ayurveda. For about 5 years, I worked in Hungary as a primary care system as a GP. So I experienced by myself the huge demand for effective, safe, and quick methods to get rid of pain. This is why I'm feeling lucky to learn Ayurveda, and and based on this knowledge, I can help to many patients. Ayurveda is personalized, as previous speaker spoke about, focus on the rebalance the body and the spirit, which is very important to work on both. Ayurveda use many techniques to relieve pain, like massage technique as Abhyanga, yoga, pranayama, meditation, which is very important for the rebalance the spirit. The proper diet is very important for the dosha imbalance. Medicated ghee, by the way, for different parts of the body as vasti can be very useful. Herbal remedies for internal use can be very effective. These are called shaman chikitsa, or for example, Shirodhara can be very effective. Because of the lack of time, I won't go in details, but all we know that modern scientific studies prove the wisdom, the efficacy, and safety of the traditional methods. In contrast, the Western medicine follow protocol which mostly based on blocking enzyme systems, and as many studies showed that blocking something usually cause side effects. Meanwhile, the body harmonization won't cause unwilling symptoms. So I would like to say I'm very thankful to Dr. Salkai to organize this program, and I'd like to encourage everybody who is interested in an open-minded journey to join us on this program, and let's spread the importance of Ayurveda, because the world really needs something effective without side effects. So thank you very much for your kind attendance.
Thank you. Please, Chongor, and sit the time. Chongor.
Yes, I am here. Okay, dear ambassador and all the colleagues, my name is Csongor Cserép. I am a counseling psychologist, and I also am a student of Ivan Salkai on the University of Miskolc. My topic is, today we are here because of COVID-19, and COVID-19 has a very big impact on the psychological way on people also. Quarantine, the ban of meeting others and to meet our beloved, especially causes anxiety. In the Western world, medical sciences are not, or medical science itself is not a holistic science, but Ayurveda is a holistic one. So psychology is in Ayurveda itself. But I think that it's a very good way to introduce Ayurveda to Western world and to Hungary on the basis of psychology. So we should make an Ayurvedic psychological therapy, for example. And so I would like to tell you some words about how to integrate Ayurvedic principles into psychological counseling. Ayurveda itself cannot be integrated into psychology because psychology is in Ayurveda. So first we have to choose the schools of psychology which consider human being as a oneness, as a wholeness. And these schools are the humanistic schools, especially the three most important: logotherapy, which was invented by Viktor Emanuel Frankl from Austria; Dasein analysis, which is based on Martin Heidegger's philosophy; and Gestalt therapy, which also considers human being as a wholeness, as a oneness. Then we have to find the fields of intervention and of diagnosis. For this, the best is Sankhya system, we know that Sankhya is not only a system, but as a system is very good to find the fields of intervention psychologically. First, Jnanendriya, the level of Jnanendriya is how the patients experience the environment and how can we change their environment at home, in their work, and so on. Then comes Karmendriya, how the patient works as a human being. How can we change his thinking? It's based on it's on the level of manas and ahankara, the outer self. We can detect the problems of the automatic thinking, the automatic negative thinking, and the problems of family, hobby, work, and nutrition also. So on these levels, with psychological counseling, we can find the problematic points and can advise Ayurvedic advices, how to change nutrition, how to use Ayurvedic clock as a changing of agenda, for example, and how to change the way of life according to Prakriti. Then comes the Buddhi. The Buddhi is most important, I think, for the therapist itself. The therapist can be effective on the level of Buddhi if he realizes his own consciousness, his or his own inner peace, inner silence, or the clear inner spaciousness. It's very important that we can only help people if we have an inner path in ourselves towards Purusha. And actually, a real good therapist must chase patient on her or his path towards Purusha, towards the inner wisdom. So I think that it would be very good to introduce Ayurveda in Europe and in Hungary on the level of psychology. And I hope that other psychologists or other medicines can help us to integrate Ayurveda into psychological counseling and psychological therapy. Thank you very much for the audience. Thank you very much.
Thank you for presentation, my students. And next time, please, the time management. Thank you for your attention.
Thank you, Dr. Shalkai and your team for participating in this webinar. It was fantastic listening to the two young researchers and doctors from your team. Thank you very much. Ladies and gentlemen, let me now welcome a very eminent Ayurveda expert, Professor Dr. M.S. Baghel, who is having more than 35 years of postgraduate teaching experience in Ayurveda. He was also the first chairperson at University of Debrecen. He is currently consultant to various organizations, including the Ministry of Ayush. He would like to inform us of the recent trends and researches in Ayurveda during COVID-19 times. Sir, Professor Baghel. Can you start, Professor Baghel?
Hello.
Anji.
My presentation is visible or not?
आपको देख पा रहे हैं हम, जब आप उसको शेयर करोगे फिर विजिबल होगी वो।
नहीं, शेयर तो कर दिया है हमने।
Sir, you have stopped sharing just now. Please do it again.
हाँ जी, अब देख पा रहे हैं हम।
Good afternoon to everybody from Indian time of presentation. His Excellency.
So sorry to interrupt, sir. Sir, you again stop the screen sharing. Yeah, this is now fine. Yes.
Good evening to everybody from India. His Excellency Tuhin Kumar ji, Manchanda ji, and all the experts, and Dr. Salkai, whom I have visited many times. I will try to give you overview regarding the recent updates, researches on COVID-19. After the declaration of a pandemic by the government of India and WHO in first week of the April, all the practices of the traditional medicines were stopped. With that, everybody was bound to follow the government of India, because in the Pandemic Act we can work only with the government of India's directives. So slowly the government of India have taken many efforts to bring down the Ayush systems in the mainstream, and this was supported by the failure of complementary medicine and their helplessness in and inefficiency in controlling such pandemic. Till date, there is no verified, proved medicine for the COVID management, though many things are being tried, hydroxychloroquine to remdesivir to plasma therapy, but none of these therapies are still have the sufficient evidence that they are effective. Ayush, in its effort, in the first week of April, they established a task force which was named as the Interdisciplinary Ayush R&D Task Force for initiating coordination and monitoring research on various aspects of the COVID-19. Then further, the national protocols for research in Ayush interventions were issued. Then further, the national guidelines for the prevention of the COVID-19 was issued by the Ayush system. National guidelines for physicians for management as add-on therapy has been issued, and a big work has been done by the ministry, that they have formed a committee, that Data and Safety Management Board. Fortunately, I am a member of this task force, interdisciplinary task force and Data Management Safety Board. So what you see, this is the stages of the COVID-19. So first was the preventive aspect, where Ayurveda did a lot. I will be coming in detail. Second was the COVID-19 clinical cases, and these clinical cases are classified in the 4 categories: asymptomatic, mild symptomatic, moderate, and severe. And many of the Ayurvedic institutions, which has been made the COVID centers later on, they have been successfully treating the asymptomatic cases, mild symptomatic cases, and moderate symptomatic cases. It is not that they cannot treat the severe cases, but as per the Pandemic Act and government's policy, the severe cases has been handed over to the medical colleges where they were treating. Now the new category of the patients we are getting in India very much, that is a post-COVID complications or long COVID. Even my private clinic, we are getting a lot of patients regarding this. So I will take your attention to these few publications very quickly. As Professor Vyas was mentioning, as His Excellency Tuhin Kumarji was mentioning, this was the first paper which come in the public domain, and they mentioned these 5 Rasayana drugs of Ayurveda: Withenia somnifera, Tinospora cardifolia, Asparagus racemosus, Phyllanthus imblica, and Glycyrrhiza glabra. Later on, with the molecular docking study, they have came down to certain plants, that is Withenia somnifera, Tinospora cardifolia, and Ocimum sanctum. As you know, that everybody is known to these plants and they are being used in Ayurveda. Later on, a task force established by the government of India from CSIR, and they have came down to these 7 drugs for the research in Ayurveda for the COVID-19 area. That is Tinospora cardifolia, Glycyrrhiza glabra, Withenia somnifera, Gingiva officinalis, Endographis paniculata, Etremisia annua, Sesame pereira, and Vitis vinifera, and Merica. Friends, this is the status of the clinical trial registry of India up to 24th June. You will wonder that at that time, 102 total Ayush clinical trials were registered. And this was forming to nearly 61% of the total COVID research projects registered in clinical trial registry of India. So you can understand that how much interest was there in Ayurveda and how much people were following Ayurveda. Out of these 102 studies, 30 trials of Ayurveda were on prophylaxis and 34 were therapeutic. In the prophylactic area, as Dr. Vyas has already told you, that very few whole system approaches were applied on the public domain. Drinking warm decoctions, nasal instillations, yoga, diet, lifestyle modulations. And big clinical trials were done on you will wonder to know the size of the data. 500 to 20,000 patient volunteers were given these things, and the data is being analyzed, and very quickly it will be available in the public domain. And it is like the comprehensive Ayurvedic protocol along with yoga, ice squat. This became so famous in India that most of the Indian population has consumed this. Later on, they have modified 1 or 2 ingredients, but it was containing ginger, black pepper, cinnamon, Tinospora cardifolia, and tulsi. This was very, very useful in prevention of the COVID-19 in the public domain. Some states have also distributed the decoction, 3 pungent things: ginger, black pepper, and piper longum. Chyawanprash was also studied in many controlled studies on the medical personnel, on the persons working in the COVID centers, and these have also been reported very good preventive aspect of this. Samsamani Vati and Sudarshan Ganvati, these were so common that they became instinct from the Indian market. These have also been selected for clinical trials. Ashwagandha has also been tried. Tinospora cardifolia, that is giloid, this becomes a very active drug and which has been used widely. Though turmeric is also very effective, but very few research protocols has been registered. One was turmeric with the black pepper, another was plain curcuma milk was tried also on the research level. the drugs being tried, which were classical drugs, one drug that is Ayush 64, which was studied previously for the dengue and for malaria. And after discussion, we found that this drug can be repurposed for the management of the COVID-19, and nearly 18 centers have gone for the clinical trial, and this data is being analyzed, and very quickly. But one thing is very wonderful, that till date, whatever the data is being analyzed, nearly no or very less ADR or serious SAEs have been reported, nearly nil. Ashwagandha has been also tried. Chyawanprash has also been tried for the management of the things. Sansamni Vati and Guruchi Ghanvati has been tried. Ashwagandha, Giloy Ghan and Tulsi Swasal tablet has also been tried for the management. So on various other decoctions like Kiratikta Dikwat and Aragvadha Dikwat has also been used. One study has been registered, ginger and garlic, which has found very good results. The Anutel and Tiltel has been tried for Nasya. Various proprietary medicines were also registered, as our His Excellency Tuhin Kantiji was mentioning. This Fifatrol has been used by the various trials, and one trial was also conducted at the All India Institute of Ayurveda, New Delhi, from where Dr. Vyas was presenting these things. So this drug has also been found very effective in the management of the mild to moderate symptoms. Tablet Brashol and Septilin has also been tried, and various other pharmaceuticals. But you will see that Giloy with Gomutra, cow urine, the capsules were also put up for the trial, and they are also reporting good effects. So, to sum up, not taking much, India government has taken a lot to prove the claim of Ayush and Ayurveda in public domain that these drugs are without any doubt are useful in the prevention of this type of the pandemics, not only COVID-19, but this type of other pandemics and endemics can also be prevented by the Ayurvedic drugs. Asymptomatic, mild and moderate cases can be managed in very less cost and without any complications of the drugs like CHQ, hydroxychloroquine, which has been found very toxic, and now WHO is reporting it has no role either in the prevention or the management of the cases. And other drugs which are also being used in modern medicine, like azithromycin. And we are finding that persons who have been overdosed with the azithromycin in modern hospitals are coming with a severe lung damage. So those cases can also be reduced, and we can find very good results. These results are under scrutiny in the Department of Ayush, in the Data Safety and Management Board. Very soon these will be released. In post-COVID cases, Ayurveda has the very much significance, and this is only Ayurveda at present which have capability to manage the post-COVID patients, because in our clinics we are getting a lot of patients related to heart, related to skin, related to lungs, related to the brain fogging. Brain fogging cases are very much coming to our clinic after the 1 month and 2 months of passing of the becoming negative from the COVID infection. So friends, this is a summary of the things which I tried to give you, that Ayush things are very good in the management of the COVID-19 situations, and they can be well managed by Ayurveda. So, Koshanam, enjoy a healthy, happy, and useful life, because this Dhanvantar Trayodasi means to give you the useful, healthy life. Namaste.
Thank you very much, Dr. Bagel, for your fantastic overview. We continue to get some comments in our chat box, which I can see, and some are very pertinent. And in the end of the program, I would like to take some comments for our keynote speakers to probably respond to some of them, though they are not exactly in the form of a question, but these are some useful comments. So thank you very much, Professor Bagel, for joining us from Jaipur. As we move on, friends, the growing popularity of Ayurveda is manifested through various Ayurvedic practitioners and organizations present in Hungary. So my next speaker is Dr. Jinse Joseph from Brahm Ayurveda Center in Budapest. He has worked under some eminent Ayurvedic personalities in India. Brahm Ayurveda also employs nearly 15 Indian therapists and doctors. So Dr. Joseph, the floor is yours.
So you need to unmute
Thank you.
yourself. Yeah.
Thank you for this opportunity, the organizers of Ayurveda Day, and Manchanda sir, and all the dignitaries. I also welcome all the viewers. I wish you a healthy Ayurvedic day. Now let's come to my topic. I will share. I hope you can see my slide.
No, sir, you have stopped sharing. You need to start the sharing.
Some technical issues are there.
No, you just
Now it's okay?
move. No, so you share the screen and then move to your slide. That's it.
Okay, understood. Now it's okay?
Yeah, that's fine.
Yes, okay. Okay, so my topic is immune boosters with Ayurvedic remedies and herbal combination to prevent COVID-19. So, Professor Mahesh Vikas is already told about some information regarding Ayurvedic way and Ayurvedic mode of treatment and prevention and improving the immune system. So, according to Ayurveda, the health is Samadosha Samadadu Samagni Balakriya Prasannatmendriya Mana Swasthaithya Bidede, which means the equilibrium of dosha, dhadu, and mala, and a person should have a proper metabolic fire and maintaining a pleasant and positive mind and proper function of sense organs. So that which gives a good metabolic activity that will help to improve our resistance power against the pathogens. So let's come to treatment. What is the first line of treatment, which Ayurveda says, Nidana Parivarjana Meka Chikitsa. So the first we need to remove the cause, so we can prevent the disease, or we will free from the disease. And also the treatment is called as that which take off the pain from the body. So now we just got through the COVID-19, as we all know that it is a potentially severe acute respiratory infection caused by severe acute respiratory syndrome, that which originated in China with the symptoms of pneumonia. So this which leads to affecting the immune system of the body. So according to Ayurveda, we can consider this disease in the initial time, we can say it is a Kaphavada Jara. Then later, it will go to Vishama Jara or Sanibada Jara. So for your information, I am saying this. Now, let's see what is the cause of lack of immunity. As we are going through a fast modern lifestyle, the diet and regimen that will make all the issues. So the cause of disease, according to Ayurveda, is saying that viruddhahara viharasya, improper diet and regimen, that leads to all the problem. So we should concentrate on maintaining the proper immunity to prevent all the diseases. That is the key point to prevent many problems. As we are taking this improper junk food and improper regimen and this modern lifestyle, that leads to Agni-mandya, that means improper metabolic fire. We are not concerned about this in the nowadays, especially those who are working in office and the sedentary life and the easy accessible to this fast junk food. People are opting this, especially in Europe and in America. We can see that those who are taking this junk food, they are suffering from the metabolic disorders. From the blood report or any laboratory reports, we cannot find out the exact issues. But almost 90% of patients, those who are coming to us, they are suffering from the same problem. That means metabolic related immune problems. We are actually not knowing about this. So what will happen when we are going to an improper diet and the regimen? Already the initial stage of immune system is active in the body. Once the initial stage of the immune system is active, most of the people are suffering from some of these diseases. That means metabolic related problem, triglycerides, elevated triglycerides, body pain and stiffness, multiple joint stiffness, and morning stiffness, muscle cramps, sleep disorders, and frequent urination. Because these all are the negligible symptoms that people will experience. Almost 95% of people, those who are coming for consultation here, they complaints about early morning stiffness. After doing some work, they are free from that. So we are neglecting that. All this problem, the bloating of stomach, especially after the lunch, most of the people complains that the bloating of the stomach, acidity, gas related problem. This denotes that the toxins, the kleda, which is present in the body, as this kleda is present, or that's the toxicity is present in the body, the primary immune system is already active. So it is a burden to our body. So when we are come across with this COVID-19, as we are not come across with this is a new virus which is acting on our body. So what will happen? The final stage of immune system will get active. So the cytokine syndrome will take place. So we can see that all the symptoms of cytokine action and the COVID are same. So that will make our body more, the resistance power will be more difficult. So it will lead to many complications. The cytokine action will lead in the body for a period of time that will be leading to much more worse conditions. So let's choose a right path. So most of us are going in a wrong way. So we need to choose the right track to solve this issue. So now let's see what Ayurveda can do, and Ayurveda as a solution. As many of the research papers are coming up from India, and I'm sharing few of our finding outs in improving the immunity and preventing this COVID. So few of these medicines are I just sharing to you, is highly effective in prevention as well as a medicine for COVID problem. So the first, the Drakshadi Kashayam, we can recommend for prevention as well as treatment, because as a preventive aspect, we should take this Drakshadi Kashayam in a toya, like that 10 ml of Kashaya added with 30 ml of warm water and should be taken 3 times daily. This will help us a preventive aspect. If those who are suffering from COVID-19, we can give the same kashayam I told you in the Vishama Jara or Sanibada Jara time, we can give this Drakshadi kashayam to help to reduce their body temperature so that their resistance power will improve. And when we are coming to Indukanta kashayam or Amrudottara kashayam, so Indukantam will Agni Vardaga, and it is highly recommended in lung-related problems. And Amrudottaram is a very good Amapachana and Vadanilomana. So this ama, which are the toxins, we need to remove from the body. Toxicity should be removed in the initial stage of the condition. That is the first line we should concentrate. And herbal tea or water, boiled water, that what we say in India, in Hungary, we used to say as herbal tea. So simple home remedies we can use to prevent these problems. A few pinches of curcuma and 4 or 5 beans of black pepper should be boiled in 1 liter of water, and you can use as a drink. And ashwagandha and guduji is highly effective. I prefer the application of guduji is more important in this case because guduji will help in Amavajana and Agni Vardhana. And gargling with herbal decoction of ajwain is highly recommended. So 1 teaspoon of ajwain should be boiled in 1.5 liter of 1.5 glass of water, that means 150 milliliters of water, and boil that warm water should use for gargling to prevent this sore throat and cough related issues. You can also drink these, as well as you can drink dry ginger tea or ginger tea, all those things. That all these herbal combinations are improving the immunity and improving the metabolic fire. When our metabolic fire is in a peak form, we can easily solve these issues. And fumigation, that is highly recommended. Why this COVID-19 came to the pandemic? Because the immune system of the society is gone. That's why it is spreading so fast. So we need to improve the immunity of the society also. So fumigation with Abarajita Churna is highly recommended, that which is following in Kerala widely. Many government organizations are providing this fumigation powder and this herbal medication as a preventive aspect. So if the Vabrajita Churna is not available, we can use Comifera Mukul for fumigating with coconut shell. That is also highly effective. And yoga and meditation is important to maintaining the mental strength. If the Sattva Bala, the power of the mind is less, that will leads to complications. So we need to improve the Sattva Bala. As a normal, so meditation and yoga is highly recommended. So Abhyangam, that means oil massage and hot water bath is also good, because Abhyangam will, for a normal person, he can follow these Abhyangam. And if somebody is suffering from any symptoms, we should avoid this oil massage. If a healthy, as a normal person, should take Abhyangam Majarate Nityam. That means every day we should follow this oil massage. That will help to prevent many diseases. In the meantime, as a preventive aspect and also a treatment aspect, those who are suffering from any other issues, even the diabetes or cardiac issues or high blood pressure, you should take a preventive aspect like this medicine plus the medicines of others. And as WHO recommended the preventive medications or preventive measures, hand washing and using the face mask, self-quarantine, keep distance, and avoid crowded places. All these are explained by Susruta, that Janadabodhamsa. So we should also follow this. And the Patya Bitya. So what you should do and you should not. Timely food is very important. That means the food you should take according to your metabolic fire. When you feel appetite, you should take food, and preferably vegetarian diet. Rice porridge, that means easily digestible food. And reduce sour and salty and spicy food, dried food. Avoid alcohol and uses of tobacco at any means. Exercise you should do till you are sweating. Avoid yogurt. And early to bed and early to wake up. Do daily meditation and pranayama. And these are the method you should follow. Thank you all for your kind attention. And if you have any doubts, you can ask me.
Thank you, Dr. Joseph, for your presentation. Dear friends, our final keynote speaker today is Professor Dr. Mrs. Asmita Vele. Professor Vele was until recently the chairperson at the University of Debrecen for the Ayurveda chair and returned to India on completion of her tenure. She is currently head of Department of prestigious institutions of Ayurveda in Pune. Dr. Vele, you have listened to all the speakers, and we have purposely kept you at the end so that you could apprise us of the current Ayurvedic interventions which you have dealt with in Pune for COVID-19, and also if you can summarize your experience of working in Hungary. Please go ahead.
Sorry to interrupt, Sir Joseph, sir, if you can stop the screen sharing.
Oh, okay. Sorry.
And namaste and thank you, Mr. Manchandaji, for a wonderful introduction. Honorable Ambassador, Mr. Kumar Tuhinji, commercial representative, and the key person behind this very wonderful celebration of Ayurveda Day from the Hungarian Embassy, Mr. Sanjeev Manchandaji, Dr. Istvan Salkai. I can see many familiar faces here. My mentor and senior Professor M.S. Baghel sir, Dr. Mahesh Vyas. I can see Monica also, Miss Monica Takach. We have worked together in Hungary for so many days. So very warm good evening and good morning to all of you. Yes, as Sanjeev ji has rightly mentioned, I am the last speaker, and yes, we have been doing a great work in India regarding this COVID-19 pandemic. The ways have changed, things have changed. We need to take up different approaches. And in those approaches, definitely Ayurveda has proved its value, its worth, and it is ready to enter the global platform with a different form. I have put together some quick slides while the presentations were going on, and I would like to share the slides with you. Give me a moment, please. I hope my slides are visible. We are talking for Ayurveda for COVID-19.
Ma'am, it's not yet.
It's not yet. Okay. Is it now?
Not yet, ma'am.
Not yet. Okay. Just a moment. I'll try again. Yes, this was the presentation. My screen.
And when you click on the start screen sharing, a pop-up will come. You need to select the window and click on share.
I can see it here, but then yes, there is a pop-up window. I can see your entire screen.
You select the entire screen. You select that entire screen and then click on share.
Yes. Start screen sharing your entire screen. Yes. And then share. Yeah. I hope now it's.
Yeah.
Now it's through.
And now, ma'am, you just open that presentation. Yeah.
It is on this in the slide share mode. Yes. Is it visible now?
Yes, it is visible.
Yes.
Yeah.
Yes, now it is visible.
Yes. So Right now, as I understand, all the previous speakers have informed us the efforts which have been taken in India to combat COVID-19 in spite of so many adversities. Professor Baghel sir has explained it to you. After listening to all of this, I thought that now at the moment there is this second wave time across Europe, and Hungary is also in that list. Yesterday's score for Hungary was 4,000 new cases every day. I'm very much happy to learn that the death toll is very minimum. So Hungarian government is doing, Hungarian hospitals and the healthcare system is doing a lot of good efforts to control the wave. And at this time, I would like to share what we did at Ayush Task Force when I was a member of that Ayush Task Force working group, especially on nutraceuticals and Ayurveda Ahar. While we were discussing about this way back in April, we had decided on these 4 objectives. We wanted to improve the vital capacity, that is Oja. We wanted to maintain digestive energy, that is Agni. Maintain the physical energy through certain yogasanas and regular exercises. Our next objective was to maintain the breath, because by that time we had realized COVID's impact on the respiratory system, and there was a lot of fear, and there is a lot of fear due to the second wave. So we must take care of the psyche of general population. So considering all these objectives, we have taken the steps like combination of modern nutrition theories and Ayurveda dietetic principles to bring out to the world that yes, this is what we can do. Wherever you are on this planet, certain things you can definitely do. Janice has also explained very easy things to make, and that was one of our steps. We have taken care of alerting the population to avoid overindulgence in some of the Ayurveda medicines, because they are hot in nature and they can give rise to, like ginger and tulsi are particularly hot for the population in northern part of the world. So about foods, living in Hungary for 3 years and making connections with so many Hungarian friends, I feel that in Hungary, what we can use is durum wheat, barley, rye, oats. And instead of going towards bakery, if we can make fresh pancakes of those, then it is definitely helpful to maintain the health. As it is, people are in lockdown, we are working from home. So instead of, we can just spend 10 minutes to make fresh pancakes, and that will definitely be helpful for our health. Lean meat in the form of soups, eggs, fresh milk without the milk which is available in carton and which is long lasting. Instead of that, in Hungary we are getting fresh milk, and that's from the local Hungarian cattle, which is a wonderful thing to have, especially in times of COVID. Then various pulses, that is barbs, mungo barb, lentil, those in the form of
Professor Vele. Abhishek?
Yeah, ma'am, you are not audible. Hello.
Professor Vele? We can't hear you. You are not audible. Suddenly the voice has gone.
Yes, I think I made the voice.
Ji, up here.
And the screen is being shared again? No.
Not yet.
Okay, fine. Let the screen go, I can talk. So, various oils, coconut oil, coconut cream, fresh butter, cottage cheese, linseed oil, these things are available in Hungarian markets, which can be used. And my previous speaker has mentioned these things very nicely for daily use. So beyond that, what we should do is to supplement. So in India also, we worked on supplementation, and we suggested that vitamin C containing fruits, especially amla, amalaki, then preserved and fresh fruits which are available in Hungarian markets. You are missing my beautiful slides. I have the photos of products available in Hungary, the ghee, then kurkuma, then shilajit. All these are available. Ashwagandha, triphala. These are available in Aldi, Interspar, which can be easily bought and added in your daily food items. Herbal teas like ginger, turmeric, cinnamon, licorice, they also can be taken up. A strict no-no, as my friend has talked to you, is about the tinned, canned food. The foods which you make today, you preserve them in refrigerator, and have the next day. These are called overnight stale foods, and especially in COVID times, they should not be fed to the contacts or suspects, and also to the patients. Rather, a healthy person also should avoid these foods. Alcohol, tobacco is a strict no-no. Mustard sauce, many people like it, but that also is not very good, because all these types of foods, they aggravate pitta, they interfere with doshas, agni and ojam. In other words, they also interfere with the metabolism at liver function, immune system, and therefore these are harmful behavior. There are a few research papers which have very nicely shown that Abhyanga prevents the entry. Abhyanga creates a layer of oil on the skin, and then it helps preventing the entry of any type of microbes, be it virus or be it bacteria. So Abhyanga is one of the best thing to prevent, and also the nasal application of oil prevents entry of any microbes into the nostrils, especially for COVID-19. This is one of the wonderful tips which we have given in our list to the ministry. Exposure to early morning sunlight, intermittent fasting are also helpful. Enough sleep and rest is very, very important. You have to exercise regularly in the form of yoga or the exercise which suits your age, your some small ailments which you might be having, knee joint problem, you might be having, something cervical. So taking care of your own limitations, the exercise should be good. Fresh and warm food is the key to to prevent the disease and its entry into the body. So I feel that Ayurveda gives a very practical approach. And to summarize what my earlier speakers have said, Swasthasya swasthya rakshanam aturasya vyadhi parimokshaha is the key message of Ayurveda. That means Ayurveda tries to maintain the health of a healthy through food and exercise, and it treats the patient with appropriate medicines. As you have seen, there are encouraging reports coming across India, various trials on Ayurvedic medicines like Guduchi, Tinospora cordifolia, Withania somnifera, Glycyrrhiza glabra, Curcuma longa, Shilajit, and all these are available in Hungarian shops. So I feel that since everything is available, it's very, very it is very good that we can offer this to you, and Ayurveda can definitely help Hungarian population at this time point through the nutrition, food, exercise, and health aspect. So that's what is the main message on this Dhanvantari Day celebration from India to my Hungarian friends and all the doctors who are here, who are listening, who are joining Thank you, Sanjeev ji, for giving me this opportunity of joining you and sharing the thoughts. Thank you very much once again.
Thank you very much, ma'am. Unfortunately, I think your customized presentation for Hungary is being missed. You can email me your presentation and we will circulate to all the participants through. You can do that.
Yes, sure, sir. Sure, sir. Some Abhishek Sharma, I think there was something happening in between. And
Okay.
yes, okay.
So thank you very much for your presentation once again. And I would also like to inform the audiences that due to some unanticipated circumstances, the Hungarian Rectors Conference is not being able to participate in this webinar. So therefore, with the presentation of Dr. Vele, we end the first round of our keynote speeches and presentations. In the next round, we would present some pre-recorded videos on Ayurveda and other Indian Ayush systems. To begin with, we would now play a recorded video by Dr. Shahjahan KK, who represents a venerable lineage of well-known practitioners of Ayurveda, Unani and other Indian traditional medicine systems, and is also currently a visiting doctor at the Ayush Information Cell functioning at the Embassy of India, Budapest since 2014, providing free consultations. Dr. Shahjahan Shaju will speak on the herbs available in Hungary and in India and how it can be used for boosting immunity and treatments. So may I request my colleague, Mr. Abhishek, to please play the video of Dr. Shahjahan.
Dear ladies and gentlemen, I'm happy to be here and share my experience with you. I have spent last 11 years in Hungary as an Ayurvedic healer. Moreover, I am representing Ayush Department at Embassy of India from 2014. We provide free Ayurveda consultation on every Thursday from 2 o'clock. Due to epidemic period from middle of the March, we still continue to provide free Ayurveda consultation through online channels. Let me introduce to you this time the most popular herbs that boost the immunity system of the body and prevent sickness. Medicinal plants have been used for curing diseases for many centuries all over the world. Among various medicinal plants traditionally used for the treatment of variety of diseases and conditions. First, the holy basil is an excellent source of vitamin K, vitamin A, vitamin C and iron. It is also good source of calcium, magnesium, omega-3 fatty acid. Mint leaves boost your immune system and rich phosphorus, calcium, vitamin like C, D, E and C. Third is ashwagandha. It's one of the most important herbs in Ayurveda, a form of alternative medicine based on Indian principles of natural healing. Different kind of ashwagandha products available in the market in form of powders, capsules, tablets, lehem, that means jam, syrup like arista, thaila. Thaila is only for the external use. The other one is kalunji seed or black seed. The black seed oil and kalunji seed you can use to boost the immunity power. And the other one is guluchi, giloi. Giloi is an universal herb that helps boost immunity. It is a powerhouse of an antioxidant, fight free radicals, keep your cells healthy and get rid of diseases. Giloi help remove toxins, purified blood, fights bacteria that cause diseases. Six is one of the other plant is Zaya plant in Hungary. It's named Zaya, is saga plant. Saga tea contains a variety of powerful plant compounds. The other one is turmeric. Curcumin is the main active ingredient in turmeric. It has powerful anti-inflammatory effect and a very strong antioxidant. Lemon. It is a good source of vitamin C. It may help to prevent constipation. It supports weight loss, improve your skin quality, aids digestion and freshness breath, like many benefits. The other one is date. Date have become quite popular in recent years. Dates contain several vitamins and minerals in addition to fiber and antioxidant like carbs, fiber, protein, magnesium, copper, iron, vitamin B6. I would like to introduce some Hungarian herbs that we do suggest to Hungarian population to boost immunity, fighting virus, bacterial infection like. One is the Mejai Kakufu, Furtos Menda, Chitke Bojo, Homoktavos, Kashvirag, Obankfu, Borza, Cholan, Sekla, Araniyeso, like many herbs available in Hungary and Europe. Ayurveda is a leading option to heal the unbalance or sickness of the body. The Indian government highly support and promote the ancient knowledge to be well known all around the world. We will continue this effort and share the science of Ayurveda. Let's be guiding spirit for all of us. I wish all of you good health and see you again. Bye bye.
Thank you, Dr. Shahjahan, for your presentation. And thank you for joining us. Friends, before we move forward, let me inform you that geographical tagging, GI, is an important measure of quality and precious bioresource, wherein a few medicinal plants of Ayurveda have also been tagged. So we have Nawara rice, known as Shasti Kashali in Ayurveda, which is largely cultivated in Palakkad and other neighboring districts of Kerala. There is green cardamom from Alleppey and Coorg. They have also been GI tagged. It is also known as Sukshama Ela and Ilaichi and is used in treatment of asthma and cough. Ganjam Kevra flower is also GI tagged from the Indian state of Orissa and is used in treatment of eye ailments and respiratory disorders. And of course, saffron is GI tagged from Jammu and Kashmir and is well-known spice used in treatment of migraine, wounds, vomiting, and skin diseases. So moving on to our next video, this is from a famous Hungarian actress and brand ambassador for yoga, Ms. Bozo Andrea, who speaks very briefly on the benefits of Ayurveda for her and for the Hungarian audiences. So Abhishek, can you please play the video from Ms. Bozo Andrea?
Üdvözlöm Önöket, Bozó Andrea vagyok. Engedjék meg, hogy a járvány idején néhány hasznos tanácsot ajánljak a figyelmükbe. A koronavírus elleni védekezésben nagyon fontos szerepet játszik az immunrendszerünk erősítése. Az Ayurveda, avagy az élet tudománya a természet ajándékait, a gyógynövényeket használja az egészség megőrzéséhez, és ennek hatékonyságát tudományos publikációk is alátámasztják. A jóga magyarországi nagyköveteként szeretettel ajánlom figyelmükbe az Indiai Követség honlapján közzétett indiai ájurvédikus szakemberek által javasolt módszereket, amelyek bár nem számítanak gyógymódnak, de nagyon nagy segítséget nyújthatnak a megelőzésben, kiemelt figyelmet szentelve a légzőszervek egészségének. Vigyázzanak magukra, vigyázzanak az egészségükre. Namaste.
Thank you very much, Ms. Bozo Andrea, for your message. I can also see that she was very excited about this Ayurveda webinar today, and She posted on her Instagram account tagging us in Hungarian language about the webinar. So thank you for your support and cooperation in this matter. We look forward to keep in touch. Friends, our next video with a brief explanation is on the mudras for the three bodies as demonstrated by an Ayurvedic doctor, Ms. Chandrika Chaitanya, and comes from the Vedic Foundation of the Himalayas in Hungary. Ms. Bhagirathi Chaitanya would like to introduce the video to us briefly, whereafter I would request Abhishek to play the video. So, Ms. Bhagirathi Chaitanya.
Namaskar, His Excellency, distinguished and respected experts of Ayurveda, dear guests and listeners. Ayurveda is such a colorful treasure box from which our Ayurvedic doctor Chandrika Chaitanya selected such an important mudra, the prana mudra, for the invocation of energy. Let us draw more attention on the subtle practices of Ayurveda as well, since we have 3 bodies and 5 koshas, or layers. Just take 3 minutes of your precious time and practice the following exercise consciously to get more prana, vital energy, and attract health and mental strength. This later is becoming more and more important. We are not only what we eat, but also what we think. So think good, speak good, and do good. And so you will emanate goodness to others around you, and that goodness will come back to you and will make you very powerful. And this is really a simple and effective way to face the current COVID-19 situation. So may Lord Dhanvantari bless us with good health and happy Diwali in advance. Thank you so much.
Abhishek, can you play the video now from the Vedic Foundation?
Prana Mudra, invocation of energy. Sit in any comfortable meditation posture, preferably Padmasana, Siddha or Siddha Yoni Asana with the hands in Bhairava Mudra. Close the eyes and relax the whole body, especially the abdomen, arms and hands. Keeping the eyes closed, inhale and exhale. With the breath held outside, perform Mula Bandha while concentrating on Muladhara Chakra. Release Mula Bandha. Inhale slowly and deeply, expanding the abdomen fully. Simultaneously raise the hands until they are in front of the navel. The hands should be open with the fingers pointing towards each other. Feel the prana or vital energy being drawn from Muladhara Chakra to Manipura Chakra in the spinal column. Continue the inhalation by expanding the chest and raising the hands up to the heart center. Feel the pranic energy being drawn up from Manipura to Anahata Chakra while inhaling. Draw even more air into the lungs by slightly raising the shoulders and feel the prana being drawn up to Vishuddhi. Retain the breath inside while spreading the arms out to the sides. The hands must be level with the ears, the arms outstretched but not straight, and the palms turned upward. Feel the prana spreading like a wave to Ajna and Sahasrara chakras. Visualize an aura of pure light emanating from the head. Feel the whole being is radiating vibrations of peace to all beings. Now slowly return to the starting position while exhaling. During exhalation, feel the prana progressively descending through each of the chakras until it reaches Muladhara. At the end of the exhalation, perform Mula Bandha and concentrate on Muladhara chakra. When the practice has been perfected, visualize the breath as a stream of white light ascending and descending within Sushumna Nadi. The same principles can be practiced in a standing position like we do it in Vyayama. Focusing on the breath taming the breath, coordinated with nice circular and harmonious movements. Working with the three bodies, physical, astral, and causal body. Namaste.
Thank you, Vedic Foundation, for your presentation. Friends, our next video is focused on homeopathy's contribution on maintaining a strong immune systems in the times of COVID-19. We have the pleasure of playing this video from Dr. Ms. Andrea Shekelai, a passionate homeopath and a former management consultant. Abhishek, could you please play this video?
Hello, and welcome to Ayurveda Day and a short talk about homeopathy and the immune system. Homeopathy, just to recap, it's a safe and gentle, individualized nanomedicine using small nano doses of natural substances as therapy. It's based on the empirical discovery that similars have a healing effect. In India, it's an important part of the Ayush traditional systems of medicine. In fact, it is the only European non-conventional medicine adopted by India, where approximately 160 million people use it for their healthcare needs. In this short video, I'll talk about what you can do during pandemic times by employing this gentle medicine to keep yourself free of infection, based on the homeopathic concept of immunity. I'm not going to talk to you about how to treat positive cases of COVID. This is regulated differently, strictly by country, and needs individualized professional help by those licensed to treat. So health is defined by many holistic philosophies as the ability to adapt flexibly and successfully to changing circumstances in your environment. This view is shared by homeopathic philosophy. Homeopaths assert the existence of a vital force in the human being that animates organism and spirit, that is there in life and is not there in death. And this vital force maintains homeostasis, a healthy balance in your body, mind, and soul. Disease is essentially this vital force being thrown out of balance by internal or external stressors. And what conventional medicine views as symptoms of disease is actually the vital force trying to get back to equilibrium and producing symptoms in the process. So symptoms in the homeopathic approach are our friend. They show us that the vital force needs to be brought back into balance, that you need healing. And depending on what symptoms you have, it shows what type of medicine you require to heal. So to homeopaths, strong immunity equals a well-functioning vital force. What can a professional homeopath help you with? Your homeopath can give you a constitutional treatment. This is the most recommended action to keep your immune system healthy and to act as preventative of catching opportunistic infections. It takes 1 hour, the deep interview, to diagnose where your vital force is showing signs of imbalance. You then receive a homeopathic remedy that treats your specific type of imbalance holistically. Your homeopath can also treat mild acute illnesses that appear every winter. Your homeopath will also be able to help you deal with the stress of the pandemic easier. If mental emotional stress is affecting your daily life, your ability to carry out work, look after your family, see your homeopath for a remedy. If you don't have the possibility or the funds to pay for a homeopathic consultation, there are 2 remedies to remember. One is for stress, Arsenicum album, and one for cold symptoms, Aconite, Aconite napellus. Arsenicum album, based on our experience in India, is probably the #1 remedy that helps with the stress during the pandemic period. It alleviates disease anxiety, health fears, and money stresses that are common. Helps you deal with them easier. As a preventative measure, you can take Arsenicum album 30C for 3 days. You may repeat this every 2 months as required. If you have cold symptoms and your GP says it's not COVID, do take Aconite, Aconitum napellus 30C, 1 dose or maximum 2 doses, and it will stop the disease process in its tracks. In summary, keep your vital force healthy and see your homeopath. I hope this has been informative, albeit very short. Enjoy the rest of the talks on Ayurveda Day.
Thank you, Dr. Shaklai, for your presentation. Ladies and gentlemen, the global market for Ayurveda is expected to touch US $14.9 billion by 2026, growing at a CAGR of 16.14%. This is besides a huge market for Ayurveda products in India. Factors favoring the growing global demand for Ayurveda include its wide knowledge base, increasing modern adaptations of traditional procedures, trust arising out of centuries of usage, advanced educational system, and large institutional base. Key markets outside India include the Asia Pacific countries, the USA, Nepal, UAE, the Netherlands, Italy, Russia, and France. We have amongst us a video from an expert from India in strategic planning, marketing, and international relations in Ayurveda products. Mr. Sudip Kumar Jha has traveled to over 40 countries and is also a member of Hungarian Ayurveda Medical Foundation, Budapest. So here is his video coming up. Abhishek, can you please play the video from Mr. Jha?
Namaskar, a very good morning to all of the distinguished speakers in Ayurveda Day 2020 organized by the Embassy of India, Hungary. It is indeed a pleasure for me to participate in this auspicious event. For this, I am very much thankful to Mr. Sanjeev Manchanda, Second Secretary of Indian Embassy, Hungary, and Mr. Istvan Reise, Chairman of Hungarian Ayurveda Medical Foundations, and also my colleague, who informed me about this event. My name is Sudip Kumar Jha, based at Delhi, Advisor of ASSOCHAM, Indian Chambers of Commerce, and Board Advisory of ASEAN African Chambers of Commerce of Industry, and doing promotion and development of Ayush system of medicines and pathy for last 28 years. I am purely in the field of international marketing, and my entire focused area is on promotion of holistic system of medicines. The Ayush doctors from all over the world, scholars and other dignitaries are trying their level best to establish our system of medicines and pathy, but the still is not enough. The Ministry of Commerce and Ayush Government of India set up core committee to focus the promotional work in different way, like helping the exhibitor, organizer for participation and organization of different international exhibition come conference, made so many bilateral agreement with different countries, and many more other approaches. But this is also not enough. Some of us need to make our efforts for international business development. I am happy that I am one of the members doing the same for the last 28 years. So apart from the doctors, scholars and business development of Ayush specific, this is also one of the important wing which is still neglected. Some of the companies have their own international business development officials, but that is only for promotion of their own products. I am talking about the need of the specific agenda on promotions of this system of medicines throughout the globe, where we need the proactive support not only from the government of India but also the government of other countries, specifically the stakeholders of the countries where the Ayush doctors and scholars are practicing nowadays. I have visited more than 72 countries, especially for participation in different international exhibition conferences, met different chambers of commerce in different countries, participated as an industry member for different bilateral agreement initiations as per the Directive of Ministry of Ayush. In order to pledge our agenda of our Honorable Prime Minister Make in India, here Make in India is applicable for all the sectors, but I am only promoting Ayush specific achievements and approaching the legacy globally. Therefore, I am getting inquiries almost every day from all those countries for the immunity boosting products. During this pandemic situation, all over the world are still specific, and people are now getting aware about how to boost the immunity through natural medicines. So there has a huge potential market for Ayush system of medicines and pathy. Now, as per the size of the global market, global Ayurveda industry accounted for USD 3.428 billion in 2015. Projected reach in 2022 is around USD 9.791 billion. Growing CAGR, compound annual growth rate 16.2% from 2015 to 2022. Indian Ayurveda industry also estimated size of USD 3 billion in 2016. Product market accounts for 75%, remaining are services, projected to grow by 16% by 2021. So keeping in view of the data I mentioned, the Ayush fraternity need to enhance its wing for a promotion and development in international market by way of engaging marketing specialists and consultants who are typically concerned in this market. The upcoming volume of business is huge, comparable to other sectors. We will get the optimum result by way of different market survey, development of innovative products, participation in international exhibition, conference, etc. So I urge all the stakeholders, both in India and beyond, to do the ensure traditional and complementary medicine delivers on its promise of advancing health and well-being as part of the comprehensive approach to universal health coverage. Thanking all of you for sparing your time to hear my version. Namaskar.
Thank you, Mr. Jha, for participating in this webinar from India. Finally, we have a video presentation on the Tamil Siddha tradition from Ms. Borbala Kasha, a dedicated student of Siddha healer Pal Pandian residing in Thiruvannamalai. She treats people with chronic and acute conditions, applying this ancient knowledge. Ms. Borbala Kasha. Abhishek?
Did I play the wrong one? I think.
No. Yeah, you actually have played for the Sparsh Ayurveda. So
Okay.
you can complete the Sparsh Ayurveda now, and then we move to Borbala Kasha.
Okay, that's fine. Yeah.
Can we also move to the next video before I come back to Sparsh very briefly? Abhishek, can you play the video from Borbala Kasha?
Namaste, I am Borbala Kasa. I am the student of Pal Pandian who wrote a book about Siddha tradition. I am the student of Pal Pandian who wrote a book about Siddha tradition, Siddhas Masters of Nature. I represent Siddha tradition here in Hungary. I apply Siddha Vasi healing, a unique healing platform that is created by my teacher, Pal Pandian. I would like to share a recipe for prevention because during this year, prevention and the well-being of our digestive fire has become a very important and essential question. This recipe has been spread throughout Tamil Nadu. It is called green chili kashayam or siragam kudinir. Siragam means cumin, and Siddha tradition considers prevention better than cure, and food has a very important role through the tastes, through the elements regarding preventing diseases. This decoction or infusion increases the digestive fire, it enhances the pitta dosham and reduces the kapha dosham. Kapha, when it is too much in our system, can stay in our digestive tract. These spices that are included in this recipe remove this excess kapha so that we can face any viral bacterial infections the way better. So you will need 200 ml of water, 1 green chili, capsicum annum, and a pinch of turmeric and a pinch of salt and a pinch of cumin. You have to boil these ingredients for 1 minute only. And when you have to drink this decoction in the morning. This should be the first thing to take, and only after half an hour you can eat or drink anything else. And throughout these days you should not take any dairy product, so that this ama can be really diminished in your system. And for 7 days more, please drink mint leaves, infusion made of mint leaves, and take cinnamon 1 or 2 grams a day, and some shallot you have to take, or it is advisable to take. Chop 1 shallot and add some honey and have this. You will see how much this recipe helps you to maintain your immunity, and please stay safe. Narbavi, Siddha Gagabusundar says this. It means let be manifested. Thank you.
Thank you, Ms. Kasha, for your participation. We also saw a brief video from Sparsh here. They participated very intensively with us in the last Ayurveda Day when we celebrated, and I can see both Mahesh and Edith Kunat present amongst us. So my greetings to you, and we look forward to further cooperation from your side. So, dear sir, ladies and gentlemen, I am looking at my chat box for any questions. I have seen 2 comments from some avid followers, which actually have been addressed already, but I would just like to bring it to the table once more. One is about the clinical trials that Dr. Manoj Nisari ji and Vaidya Kutecha ji, Secretary Ayush, have been initiated on Ayush products and they wanted some information. This has already been answered by Professor Bagel, that it's a very long drawn extensive products and prophylactic studies. Samples from 5,000 to 20,000 are studied, and hence publication will take little more time. And a second good comment came about importance of sleep, exercise regimen, and how the modern lifestyle has neglected the harmonious existence. This has also been addressed by subsequent speakers, Dr. Jinsei Joseph. And another query is from a company in India which is into the exports of oils and extracts. And this has also been sort of addressed by Brahma Ayurveda. They're looking at cooperating, and I can also see a final comment coming just as I want to close, that Ayush Veli Foundation wants to also keenly cooperate with the stakeholders here. So questions have been answered, and so dear friends, ladies and gentlemen, with this we come to the end of this enriching discussion on Ayurveda and its salience during COVID-19 times. We have heard from the domain experts on the benefits of the Indian traditional medicine system, whose efficacy and relevance in the current pandemic times has increased manifold. I am pleased to note that today's webinar has witnessed such high-level participation, including from former chairpersons and experts from India and Hungary, and is a testimony to the potential of Ayurveda as it finds a larger role for itself on the world stage. Please do not forget to participate in our online quiz with multiple choices on Ayurveda, which we are running in cooperation with our Ministry of Ayush until the November 13th. I once again thank all the participants from the bottom of my heart and other viewers who joined us today from India and Hungary for this important webinar. And India, that is weighing the balance between economic revival and global engagement, would do well to recall Mahatma Gandhi's words that humankind is as much self-dependent as interdependent, and these words are increasingly relevant for today COVID-19 times. So thank you very much, Kosanam Sepan, and wish you a pleasant and safe times ahead.
Thank you. Namaste.
Thank you very much.
Thank you.
Thank you very much.
Thank you. Namaste.
Thank you.
Namaste. Thank you.
Namaste.
Bye-bye.
Thank you very much, Manchandaji. Thank you very much.
Professor Vyas, thank you very much for your participation. We are indebted to you.
Thank you.
Thank you.
Thank you.